Hi everyone, my name is Marilyn Quintana. I'm a regulated Canadian immigration consultant, and today we are going to talk about health care in Canada. Before we start, please subscribe to our channel, click on the little bell right below so you can receive notifications of our weekly videos, and please feel free to leave us a comment with questions, with ideas for new videos, or even to know how you are at your Canadian immigration plan, okay? In this video, I'm going to talk about the Medical Service Plan of British Columbia. So for everybody that's planning of coming to Canada, it is important to know that it is not the federal government that determine the law and regulations regarding the health services provided by the province. Instead, every province has its own regulation regarding who can apply, if it has costs or if it doesn't have costs, what's the waiting period for the coverage to kick in, right? And what are the services covered. So if you are planning to come to Canada, it is very important to review, according to the province that you are interested in moving to, what are the regulations regarding the eligibility for the medical service plan. The first thing you have to know that despite of the province, anywhere in Canada, if you are a citizen or if you are a Canadian permanent resident, you are eligible for coverage without costs. This makes Canada a way greater option to immigrate, especially comparing to other big countries like our neighbors that don't offer health care to anyone, nor even to their own citizens. So now I'm going to provide a little bit more details in specific for the province of British Columbia, which is the province that I live in, and I definitely know more about it to share with you guys. But if you guys like this video, I can come back and explain more details about other programs in other provinces. So first, the MSP, the Medical Service Plan of British Columbia, covers for free all citizens, permanent residents of Canada, and also temporary and foreign workers. So everybody that has the work permit can apply and don't need to pay for anything. For international students, however, you must pay a fee if you are here on a study permit, once you have at least 6 months of study permit validity. So let's give an example. You have a 1-year study permit and you don't apply in the first 7 months, and then you want to apply on the 7th month, you are no longer eligible to apply because you only have 5 months left. However, if you entered Canada, received your 1-year study permit, and then applied, you are eligible until the end of your study permit validity. So it is very important when you arrive in Canada, you must apply right away. However, there is also a waiting period. Even if you apply once you get here, like next day you arrived in Canada, you still have 90 days waiting period for the coverage to kick in, okay? So if you are arriving, it is important to have an extended health plan to cover you during these initial 3 months where you will be waiting for the MSP to start the coverage, okay? We do recommend that you have a private health insurance so you can be covered while waiting for the coverage from MSP to kick in, okay? So that's very important. We shouldn't joke with health regardless of the age. So what's covered by the MSP, the Medical Service Plan of British Columbia? Well, consultations, exams, surgeries, family doctor appointments, and all the regular things that you need. For example, if you need a specialty doctor, it is all covered by the MSP. But there is also some services that are not covered. For example, it is not covered physiotherapy. It is not covered ophthalmologist. So if you need eyeglasses prescription, you need to pay from your own pocket. It is not covered dentist, and it's not covered any cosmetic procedures, okay? How to apply for the MSP coverage? In some countries, we are very used to see that the public services are very difficult to access and difficult to apply. Most places, like the place that I'm from, you don't have usually online services to apply for government benefits. You have to go there in person, and there's a lot of forms and bureaucracy. And this is completely different here in Canada. To apply for MSP, as well for most government services, it is very easy. You can do online, so you just have to complete an online form and then add a scanned copy of your documents, and you're going to receive the invoice and the coverage card on your house few weeks after the application, okay? Well, the process is very simple, as you can see, and you're going to leave below the link of the website so you can take a look by yourself. For the additional services that are not covered, many companies offer extended health insurance that allow you to have additional coverage for those services. So it's very common here for medium-sized to bigger companies to offer that as a benefit to all their employees. So in this case, you could have coverage for the cost for medicines that usually don't have coverage by the MSP. You could have coverage for psychology therapy. You could have cover for physiotherapy, acupuncture, massage therapy, well, anything that you need that's not covered. And it's very common, as I mentioned, to have that as a benefit once you are here in Canada working full-time for an employer. Now that you know how the health public system in Canada works, you are ready to put your immigration plan in practice. So get in touch with one of our specialists in visa and immigration and schedule a personalized consultation so we can determine the best strategy to allow you to live your dream. I hope you guys liked this video. If you guys liked, give us a thumbs up. Don't forget to subscribe to our channel, and see you guys next time. Bye bye.